Taking a look at some of the questions that you are asking, and here's one from Catherine C. Catherine wants to know, can statins cause muscle pain, and what can I do for prevention?
Great question. Statins, which are those medications that we use to reduce our cholesterol and reduce our risk of heart disease and stroke, it's often, unfortunately, or it's not uncommon to be associated with muscle pain. Up to 20% of people who take statins will come in with muscle pain. So what do you do about it? Number one, you want to make sure you talk to your provider before you just stop medications. There are clear benefits, and muscle pain might not be an emergency or an emergent issue in terms of changing your body dynamics. And so you want to make sure that you're getting the most benefit out of those medications. And then if that continues, it sometimes can involve changing the medication, because not all statins are created equal. Sometimes if you have muscle pain with one, you might not have muscle pain with another. It might include decreasing the dose, or it might include checking things like your thyroid, for example, or your vitamin D. Having low levels of that can increase your risk of muscle pain associated with statins.
Your prescription for wellness?
Telehealth visits. You know, since the pandemic has started, it has grown in popularity. Getting ready for your telehealth visit, though, is very important. Unfortunately, although access has increased, the amount of time that you have with the provider has stayed the same. That 15 to 20 minutes is crucial. So today's prescription for wellness are on some things you can do to get ready for that telehealth visit. You want to start by making sure that you know your current medications, and that includes medications that you get over the counter and any supplements that you take. And then write down your symptoms, your questions, and concerns. You want to make sure you go into this appointment informed, aware, and ready. And if needed, take your temperature, your weight, and if available, you can check your blood pressure so that you can have what we need, which are vital signs. And then make sure that you keep a pen and paper to take notes. It can be so confusing and sometimes scary when you're trying to get that important information. So making sure that you're writing it down can help you be a better patient and help you get to that next step.
And
Go ahead.
My pro tip, because I've failed at this multiple times, is to check your login, that you know how to sign in and that you forgot your password, and then you're late for your appointment.
Very true. Very true.
And you might have to pay a little fine or a little fee or
Or
something.
you just might have to wait for a long time for the next appointment. So getting ready
That's
for it.
good advice there.
Very
I
good
can imagine.
I've messed that one up a few times.
Find your password. All right, Doc, thank you. And folks, we would love to hear from you, so please hit us up on Instagram with all of your medical questions for Dr. Darien at ABCGMA3.